The World Health Organization says the spread of Ebola in Liberia may be slowing, but warns that it's too soon to say it's under control. While here in Washington, President Obama has warned that there may be more isolated cases of the Ebola virus in the US. He went on to say that the US mission in West Africa is making a difference. For more, I spoke a brief time ago with Dr. Gavin Macgregor-Skinner from the Department of Public Health Sciences at Penn State Hershey. I started asking about the president's strategy to reassure the US public.
At the moment, we're seeing different states within the US come up with their own policies and regulations. And it's really important that we need a leader like President Obama to bring all those governors into Washington, put them on the same page, and then ask every state here in the US, what do you need for your hospitals to be prepared, but also for the National Communication Plan, a National Ebola training program, so that we get everyone on the same page.
So you feel that they're not on the same page at the moment, and in fact, all members of the US military returning from West Africa are now, we learn, going to be placed under supervised isolation for 21 days. That's going further than what's required for doctors and nurses. It's confusing, isn't it?
Well, having been to West Africa and returned back with my team, we follow the CDC guidelines, which talks about controlled movement. And that means stay away from commercial transport, stay away from public transport, but don't be locked in your house in one room. You can actually go outside of your house and, again, still monitor yourself every day, temperature, and look for symptoms.
But in West Africa, where, of course, it's so serious, the World Health Organization did report today that the rate of new Ebola infections in Liberia seemed to be declining. What do you read into that?
If what the WHO is saying is true, that's very good news, but it may be too early to call. If what the WHO is saying is true, then we have to quickly move to phase 2 of attacking Ebola, and that is to get out to those areas where there is maybe a decrease in the number of cases or Ebola-free zones, and send out those public health experts under phase 2 to maintain these areas to be free from Ebola. Phase 1, we sent doctors and nurses. Phase 2, public health experts.
Now, you were in the region. How much of a problem do you think the underreporting of cases is?
Oh, it's a very large problem. It's a huge problem. Even when I was there, we kept hearing rumours and myths and people saying, I don't want to go to the hospital because people die in the hospital. It's really important right now to engage the community, both the religious leaders, the traditional leaders, and witch doctors, whoever may be there, again with evidence-based medicine.
There's been a steady increase in cases in the west of Sierra Leone. We're seeing that now. And the president of the country said that people need to change their behaviour. What does he mean exactly?
I think he's referring to, again, this community engagement, this community awareness, but ensuring that people take precautions. And we've seen in many of these countries, people put on plastic bags on their hands to treat and also to deal with those that have died from Ebola. So again, taking those universal precautions, like if we would put gloves on, you could put plastic bags on, but still have contact with Ebola people.
Do you feel now the world is moving fast enough to respond to this outbreak?
What we've seen in the last 2 weeks is a much more designated and committed effort by many countries. We're now starting to see that supplies are arriving. But I've just been told today that if I was going to be deployed now with my team, I would have to take all the personal protective equipment that I need for myself because it's just not available there. So I have to leave the US with everything for maybe if I go for 3 to 4 weeks, and that wasn't happening a month ago.
Dr. Gavin Macgregor-Skinner, thank you very much for joining us.
You're welcome.